Okay, for this next section, 16.4, we need to understand a little bit more about sexually transmitted infections. All right, so these are diseases that are mainly transmitted during sexual intercourse. Okay, so we call them sexually transmitted infections, STIs, or STDs, sexually transmitted diseases. So it can be transmitted through a few ways. For example, through blood transfusion. Not in Singapore. In Singapore, usually we screen the blood properly to make sure that there are no viruses inside, although sometimes the viruses can still not be detected, or the bacteria, or sharing of unsterilized or contaminated needles. And this can be, for example, when you go for tattooing or when you do injections, okay, or can be transmitted from a mother to an infant during childbirth or breastfeeding. Okay, so if the mother gets the STI, uh, while the child after the child is born, the child can still get it through the breastfeeding process. Okay, so but the main cause of this will still be through sexual intercourse. Okay, so there are a few types that we need to know: syphilis, gonorrhea, and HIV. Or HIV is a short form for human immunodeficiency virus. Okay. The important thing here is to understand the type of infection that they are. Okay, maybe I'll just put a star here. All right, so for syphilis and gonorrhea, they are bacterial infections, whereas for HIV, it's a viral infection. All right, so all these three diseases have different symptoms and long-term effects. For example, syphilis, can cause blindness, paralysis. Gonorrhea can cause infertility, long-term pain. HIV will cause something known as AIDS. AIDS is something that short form for acquired immunodeficiency virus syndrome, but basically it means that you have a very weak immune system, and so you can fall sick severely just from a very simple disease. All right, but we do not need to know the symptoms and the long-term effects that much. Okay, really, but the main thing is about the cure. Okay, we are also interested in the cure. So currently, antibiotics, okay, can be used to treat gonorrhea and syphilis because they can be used to kill bacteria. Okay, so antibiotics kill bacteria. But unfortunately, antibiotics have no effect on viruses. So, um, for viruses, okay, example HIV, there is no cure. Currently, it is considered to be no cure for them. Okay, so antibiotics can only kill the harmful bacteria. Okay, so in order to prevent the sexually transmitted infections, okay, the most important method is using condoms. All right, so when you use condoms, the sexual fluid is not transmitted to the other individual. Well, while it's effective, it's not completely effective. All right, so the best way to avoid that is still by practicing abstinence. So okay, so abstinence means no sexual intercourse. All right. Okay, so let's just take a look at the bottom, the learning points, just to identify whether you know the answer. Okay, so birth control method that can prevent transmission of STIs. That only one is condom. Okay, the diaphragm. How does the diaphragm and other birth control method works? Okay, diaphragm will prevent the sperms from entering the uterus through the cervix. Okay, because the diaphragm covers the cervix. The intrauterine device, basically, there's a lot of ways, but the traditional one will be preventing the implantation of the embryo. Okay, birth control pills generally will prevent ovulation from happening. All right, so eggs are not released. Okay, two STIs that can be caused by bacteria. They are the two that we have learned earlier in this video: gonorrhea and syphilis. Uh, can viral STIs, the only one that we know is HIV, maybe cure. Unfortunately, the answer is no. All right, so that's all for this segment.